Hi, for this module's Practice Clinical Pro, I want to talk about how important it is to know that you can restrict certain conditions, medical conditions, into your practice. So I remember when I was first in practice, maybe like my first year in clinical practice, I met a patient who had a huge impact on me. And my patient was actually on the California Medical Board. And he was really a big believer in alternative medicine, and I was helping him with alternative medicine strategies for something. And he's like, listen, and after I got to know him, we became good friends. And he's like, listen to Tease, I'm going to give you one piece of advice. And I'm on the medical board, which is different than the chiropractic board, but I can tell you, we see a lot of problems with this. Just don't don't work with cancer patients. There's just too much concern there. Now, I at that time had no intention to, because for me, um, I didn't want to spend that time and invest the time to become an expert in strategies for that. And I didn't want to be put in that environment where we're trying to incorporate diet, nutrition, lifestyle strategy. Obviously, there's not a treatment for cancer. You just try to optimize the patient's health, hoping that they can recover. But I really personally didn't have any traction to that. So, for over 20 something years, um, I've never worked with patients that have ever been diagnosed with an active cancer. And I don't intend to do it the rest of my career. And it's not so much for any kind of legal issues, because ultimately, again, we're just trying to improve anyone's health, whether they have a condition or not. We're just trying to make sure that they can sleep properly, digest their foods, have their inflammation under control, um, identify any food reactivities, try to reduce their chemical load. I mean, those are just general things to improve anyone's health. It's not necessarily a treatment for anything. But I decided that I just didn't want that type of energy in my practice. I also, for example, when I work with children that have child developmental disorders, I don't work with any divorced parents. And that's quite difficult because the rates of divorce are pretty high when a child has a developmental disorder. But I find I really can't juggle interventions and treatment strategies when parents are divorced. And a lot of times there's still anger and there's still a lot of issues between parents, and it becomes very, very inefficient. I just don't want to be stuck in the middle of that. So I say this to you in this module because I really want you to really think, do you have any restrictions of medical conditions in your practice? Are there things you just don't like to work with? Are there things that you um, feel really have a psychological impact on you? Are there certain conditions where you just don't feel like you have the desire and energy to put in the clinical time you need to learn how to support people with uh, various mechanisms? Those are things you really want to think about. And I think when people start to dive into functional medicine, with functional medicine, it's really not based on treating any kind of condition. In functional medicine, you're just trying to figure out where the body is not functioning and then try to support function. So it becomes irrelevant in many cases of what their initial diagnosis is on, because ultimately you're trying to just optimize human function. And whether that human function is immune related or cognitive related or blood sugar stability related or just dietary nutrition balance or prostaglandin balance or hormone balance, whatever the scenario is, I mean, that's really ultimately what we're doing in a functional medicine model. So just a heads up that you really should think about what you don't want to treat, and then let your staff know, and then have the process of just restricting certain things that you don't want in your office. Now, for some people, they may think that's a cop out. They may think you should kind of support anyone who needs help, but I don't agree with that. And I would encourage you to really figure out things you're most comfortable and excited about working with, and mechanisms you really feel you can really help, and what various types of things you don't feel excited about, and maybe start to focus your clinical model that way. It's very common for practitioners to have expertise in certain areas. Maybe some practitioners really love to work with people that are dealing with infertility. Maybe some people really love to work with people that are starting to notice some degree of cognitive decline, but they don't really think about what things to restrict. And it's important for you to really think about that as well. Anyways, I hope that's useful for you. Thank you.